Hi, my name is Barbara Wakefield, and I had the Da Vinci robotic bypass heart surgery about exactly 1 month and 9 days ago. And I am here to tell you that it is a fabulous procedure. To give you a little history, I am 62 years old. I have been diabetic type 1 for 50 years. And about 1.5 years ago, my cardiologist told me that I was going to have bypass surgery and that I couldn't wait too long because there was not a large window before it was necessary for me to have this, and if I didn't have it, I couldn't turn back. And so I went home and did some deep thinking about this and realized my father had had it probably 30 years earlier. And when he came out of surgery, he turned to my mother and said, if we didn't still have children at home, I would not have made it through this surgery. He said it was the worst experience he'd ever had, and he was a World War II veteran who had really been badly beaten up during the war and spent 2 years in the hospital. So he had had a lot of experience and said that bypass surgery was just miserable. And so with that in my mind, I just decided I couldn't handle surgery like that. I'd had enough through my lifetime, and so I decided not to have surgery. I was forcing myself into pretty much a death pronouncement because I was not willing to have that bypass surgery. So that was about 1.5 years ago, and fast forward to today, I was sitting in my kitchen reading the morning paper, and there was an article about Dr. Poston, who was brand new to Tucson, and he said, and it said about Dr. Poston, that he had come to UMC to start the Da Vinci bypass surgery. And I had no idea what Da Vinci robotic bypass surgery was. And it explained in the articles a little bit about it. And after I read it, I thought to myself, this is the answer to my needs. And so I immediately picked up the phone and called the number that they listed. Well, it turned out that it was Dr. Poston's own personal number, and so he picked up the phone. And I thought, goodness, here's a doctor, and I'm going to present my case to him. So we talked for for a short while. I explained my situation, and he said, sure, I'll talk to you. Let me get some information from your cardiologist, get your EKG and a few other tests that he's done, and let me review it, and then if you are a possible candidate, you can come in and we'll talk about it. So he got the information. He called me a couple of weeks later, and I was in there sitting talking to Dr. Poston within a week or so. And after reviewing my tests and whatnot, he said, I think you're a very viable candidate. And so I said, well, how nice. And I pulled out several pages of questions for him. And he sat there kind of, wow, you have got a lot of questions. And I just wanted to kind of meet the woman who would call me directly and ask if I would take her on as a possible candidate. But anyway, he was extremely nice and answered all my questions, from the simplest, will there be any scarring, to the extreme, at what point do you regress back to the traditional bypass surgery? And after he answered all my questions, I kind of left that meeting feeling very confident that this is what I needed to have done. And so we set up a surgical date, and that was really how it all started. The day before the surgery, they had me go to pre-op, and that is where I met wonderful people. And it started the whole situation, started the whole surgery operation, informative information in such a nice way. Amongst some of the people that I met was my anesthesiologist that would be working on me personally. Professionally, he was very good, but he also took time out to answer any questions that I had on a personal level. And he acted as if we had all day. So that made me feel very good. The head nurse of ICU also came in and introduced herself, and she is such a nice gal. She is part of Dr. Poston's team, and she was so nice and so informative about what she'd be doing in relation to me, and told me that if I had any questions and my personal nurse couldn't answer, that she would be available for any questions that I had. So I left the pre-op feeling very confident and very relaxed and not concerned about the surgery. So the next day was the surgery date, and I came in, and it was immediately taken in, and quite honestly, I don't really remember much after that. People who took care of me were very nice and very informative about what they were doing and what I could expect to have happen. But they started me on drugs, and it was just wonderful. So after that, the next thing I really do remember is waking up. And my concern through the surgery was that I might have a stroke, a heart attack, or they would do the regress back to the traditional heart bypass. And I was really afraid of all three of those. And so as soon as I started waking up, the nurse and the doctors were all standing there telling me it was such a good surgery. There were no complications. It was wonderful. I didn't have anything to worry about. And so I was feeling very confident. I will say that the one thing, or not the one thing, but one of the things that Dr. Poston had talked to me about was the breathing tube that they put down your throat during surgery, that I might or may not have it when I come out of surgery. And so since he had touched on that, and I came out of surgery with the breathing tube still in, I wasn't concerned about it. And that would have concerned me if I didn't know why it was still there. And so it's just these little things that they kept communicating to me that made me feel so confident about what I was going through. And it wasn't only Dr. Poston, but it was his whole surgical staff that was so attentive, and they kept telling me what to expect and what might happen, and if it did happen, this is what they would do. And so the surgery itself was really very non-eventful, and then they put me into ICU. And ICU, the whole nursing staff was exceptionally nice, and they were so attentive, and it was wonderful because I had a lot of family here, and everybody wanted to spend the night with me, so they certainly allowed at least one person to spend the night, and so that person each night who spent the night with me talked to the nurses, and the nurses talked to them and talked to me, and it just kept us so well informed. Communication seemed to be one of the most important factors in their presentation of the whole surgical situation. And one of the most important things I think that went on was when you have something like this happening to you, you get very concerned about little things, that you're not sure that you can ask a doctor or a nurse or anything else, or anybody else except somebody who has been through it. And a few times that's what I experienced. I didn't know who to ask the questions of because nobody had been through it around me. So I would ask nurses, and they would be as helpful as they could be, but they had never experienced it. And Dr. Poston would come through, and he would speculate on what was going on or what I was concerned about. And most of the time, he came up with with an excellent answer. But I needed somebody who had been through it, and I didn't have the availability of anybody like that. So I've gotten sort of off track here, but anyway, after I went through ICU and stepped down, all the nurses, the doctors, everyone was so helpful, and they were so anxious to get me up and out of bed and then out of the hospital. And so, believe it or not, I was in and out in 3.5 days. I was amazed at that. For a sideline with diabetes like I have had for 50 years, you have more complications than you can ever imagine. And yet I had major surgery and I didn't have any complications. And they had me up and out of the hospital in 3.5 days. One of the greatest things is to be able to go home and do your recovery. Recovering at home is so much easier and so much better than it is in the hospital, as everybody imagines or knows. And so when I got home in my own personal surroundings, I was swimming in 6 days after the surgery. That to me is an amazing statement right there, is that I could go swimming after 6 days. So the reward of this surgery has just been fabulous. As I said, I had the surgery a month and 6 days ago, and I am in fabulous condition. I'm doing almost everything that I was doing before surgery. I have very little discomfort at all anymore, and basically I had little discomfort from the beginning. And so what I think the most important thing to me is that everybody communicated so well, and the recovery factor, the minimal amount of time I spent in the hospital, the minimal amount of time for the recovery, and is just amazing. And so, if all I'm saying is I hope that everyone will consider having this surgery before they make a final decision. So good luck with your decision, and I hope it goes as well as mine did. Thank you.